So in this talk, I'll quickly define what we mean by risk communication and community engagement. I'll provide a brief overview of some social behavior change and risk communication theories used in outbreaks. I'll touch on messaging, and then finally, I'll provide a brief overview of some of the challenges and guidance for conducting risk communication and community engagement in low resource settings. So maybe just to start, risk communication and community engagement, or RCCE, is a pillar in the response. So these used to be separate pillars, with risk communication focusing on spokespeople and the media, and then another social mobilization pillar which focused on community level outreach and engagement. So risk communication and community engagement now combines the principles of both processes to really provide timely, life-saving information to people who need it, while reducing that stigma and misinformation that's so prevalent and detrimental to the response. It also means identifying and supporting community-led solutions and listening and responding to community feedback while using innovative approaches and data to encourage social behavior change. Social behavior change being that process to understand and facilitate change in behaviors, social norms, and the contexts that drive them. So I'm going to talk a little bit about some of the theories that we consider during outbreaks. So I'll quickly run through three of them. There are many. So theories can help us define our research or show us what activities and messages lead to the greatest impact. So for example, in risk communication, this extended parallel process model states that for individuals to take protective action, they must feel threatened by the consequences of a behavior, and then feel able to act to avoid that threat while believing that that action is effective. So it's that balance between the perception of threat and the perception of, and then the perceived self-efficacy. So for example, if the perceived threat is very high, but we don't really have the confidence to be able to act to do something about it, generally we're controlling our fear and we tend to reject those messages. Similarly, if we don't feel enough threat, if we don't feel the risk, it's the same. We tend to reject those messages that are coming at us. And so having that balance between perceived threat and perceived efficacy is really important. So understanding, people's perception of risk and fear, and then building the confidence and skills to take action is so important. And we can engage the media to support these objectives. For example, if we know that the media is a trusted source of information. So the social cognitive learning theory acknowledges the constant interaction that exists between individuals and their environment. And so seeing others, model the behaviors and observing the benefits derived and seeing that those benefits outweigh the costs, whether that's hand washing or attending an isolation facility, is key. So we need to know what's in it for us, generally. And again, that the benefits outweigh the costs. So in the case of an isolation facility, for example, those costs may be really high, such as stigma or being away from family. So we must have also the self-efficacy and the confidence and the ability to practice the behavior, and that practice will be effective, as was mentioned before. So we can promote role models that could be in person or through the media by real or fictional characters that demonstrate those desired behaviors and those benefits. The diffusion of innovation theory describes how new ideas are spread through a community or a social structure. It's characterized by those early adopters and illustrates really how people are initially slow to adopt new behaviors. But as the behavior becomes better known and accepted, more people practice it. So communication channels can influence how quickly an idea is shared, and you can help an idea become more popular. So social behavior change intervention should work with influential leaders, whether that's community or religious leaders, and other individuals that can be role models, to encourage them to adopt a new behavior and promote it to, members of society. People will also want to know, how simple is the behavior? Does it work for me? Can I see it? In some cases, can I try it? And then finally, common in social behavior change design is the socio-ecological model, which illustrates that many factors influence our decisions and our actions and health behaviors at multiple levels. So from the individual to the family, peer, the community, service, and structural level. There's lots of variations of this model, but the point is that we live in households with families and peers who we interact with, and we live within communities with health facilities and other services and policies that guide our actions. And so individual behavior change is challenging if we don't have supportive environments that enable that change. And maybe just a very quick example, I was just speaking to one of my colleagues from a CCP sister office in Pakistan, who says that in their COVID-19 response, at the risk communication and community engagement coordination level, they collect all sorts of data that they analyze and provide recommendations to implementers at the field level. So they're providing recommendations on not just sort of the individual level and community level behavior change, but also those systems recommendations. So for example, if they're hearing information, if they're getting information on violence against health workers, they may provide recommendations on, what kind of laws then are in place to help to prevent that. And so again, just looking at not just, those individual and community level structures, but this overall structural and policy level too, is something that we do in risk communication, community engagement. So maybe just a note about messaging for COVID-19. These are basically general guidelines that can be applied in any outbreak context. And maybe I'll just, highlight a few of them. So it's important that specific messages be developed to target key population groups, so that we don't just blanket messages to general populations. So we can be more specific and target adolescents, for example, who maybe have more social contacts, or the elderly who are more at risk of serious outcomes, or those who have influence over people's health behaviors. So in some contexts, like men or older women or traditional or religious leaders and healers. It's also important to acknowledge the challenge that people face in complying with the measures. So for example, telling people to physically distance when it's impossible for them to do so in some contexts, some urban settlements, for example, this will really only lead to frustration. So acknowledging that there are those challenges while facilitating alternative solutions is really important. Being clear and simple and practical, and ensuring that our messages are locally contextualized in local languages, that we're clearly explaining measures in each community. So, as many of us know, health illiteracy in some areas is a real issue. So there's a real lack of understanding of a virus and what it does. So focusing on building people's understanding of how the virus transmits so that these prevention measures make sense. Ensuring that there are linkages to available services and resources. So in many contexts, people are really feeling the impacts of COVID-19 and the public health measures. So our messages should provide details of, social safety nets where those are available to counter the impacts of lockdown. And then maybe just importantly, one more thing about making sure that our messages really don't contribute to the stigma, but that we're highlighting then the importance of social and collective responsibility. But it's important to also note that risk communication and community engagement really goes beyond the delivery of simple messages or slogans to include a full range of ways in which people individually and collectively act and convey meaning. So I want to talk, just say a few words about community engagement, because it cannot be stressed enough that communities really must be at the center of any public health intervention, especially in emergencies. So after reflecting on the Ebola response of 2014 and 2016 in West Africa, response organizations came together and they jointly defined 6 core standards for community engagement. In short, we, as NGOs and others in the response, we really need to prioritize our role as supporting communities to become empowered to define and address their own solutions and engage local actors in local languages and build on those local capacities and resources. So also, as many of us, I think, know, during COVID-19, we've really had to be a bit more creative about how we're engaging communities so that we're informing and supporting community-led solutions, even during these lockdowns. And so I also co-chair a global subgroup on community engagement in low resource settings. And so one of our first initiatives was the development of this tips for engaging people in low resource settings, remotely and in person. And so, how to engage where there are movement restrictions and physical distancing measures in place. So I'll just quickly go through some of the contents in here. So we've had to really consider different options on collecting, perceptions and community feedback and other data remotely to understand the knowledge and concerns and perceptions, the stigma, and the behaviors around the disease and preventative actions. It's important though to note that, for some vulnerable populations, they may not have access to, mobile phones or different technologies. And so, we've also come up with some other innovative ways of how we're reaching community members. So for example, one of our CCP offices in Indonesia, they leveraged the food aid workers who were going door to door to deliver food aid. And so they provided these food aid workers with phones. They wiped down, when they went to the house, they wiped down the phone, gave those phones to the household. On the other end of that phone was someone from our Jakarta office, one of the researchers monitoring and evaluation, who was conducting the interview over the phone. That person then gave the phone back to the food aid worker, who then wiped it down again. So coming up with some of these creative solutions has been really key. Hotlines, of course, we use these to not only provide information, but also to collect information that we can use then to inform our response. And then fostering these virtual discussions using different technical platforms. So we've used WhatsApp a lot where that's been popular. So there's already a lot of WhatsApp networks that we've been able to tap into. Even with refugees and IDPs and migrants and the representatives of those groups and their networks, and using Zoom and other tools have become more important. But it also really remains important to understand, how people are already communicating and getting information. And especially during COVID-19, it's important to learn the preferences in communication channels in those trusted sources. Supporting community-led solutions. I've mentioned this already, but things like physical distancing, isolating people in the home who are sick, these can be more difficult depending on personal or household environments. So this could be because of a lack of resources, the nature of the built environment, so crowded buildings, for example, cultural or religious customs, and so on. So people can really develop effective measures on their own, which may be more appropriate to the local context than these broad-based policies developed by central governments and others in the response. And agencies could really support these community-led solutions. And I'll provide an example of that a little later on. We've been using interactive radio. Similarly, we've been able to use that to, not only collect information from listeners who are using SMS and sending in questions, but then to respond by bringing in experts to those community radio programs to be able to respond and answer some of those questions, as an example. And we've been able to use that to address rumors and misinformation as well. Importantly, we've needed to look at some of these non-tech and non-mobile options. And again, there's been some creative ways in which we've been able to reach communities and provide information. So for example, incorporating some messages into daily prayer calls, for example, and looking at how people are interacting on a day-to-day basis and recruiting some of those people in the community to be able to provide information. So whether that's, a taxi driver or a shop owner, these are other ways in which we've been able to engage with communities to be able to provide information, life-saving health information. There's still home visits that are being done by frontline workers, community health workers, community-based volunteers, and we have come up with protocols to ensure that, when they are reaching households, that they're doing it safely. And then, online and mobile training for frontline workers. So training, we've provided some options for conducting training at a distance. Training on how to identify people most at risk of severe COVID, recognizing those symptoms, and importantly, incorporating COVID-19 messaging into some of the existing programming like malaria or nutrition, for example. So now we've gone to the next level where a lot of countries have been opening up and then opening up and then closing again. So our subgroup developed this planning guide for adapting risk communication and community engagement as public health and social measures shift. And so, we had to look at how to collect and discuss some of these, rising topics that are coming up, that are bubbling up to the surface. So for example, a lot around the impacts of COVID-19. Some of it is on, of course, income generation activities that have been impacted, or an increase in gender-based violence. So really having a better understanding of what the issues are that people are most concerned with now. Making sure that we're maintaining these essential prevention measures, even as countries are opening up, and really sort of that provides a cue, I think, to people to be able to lessen their behavioral practices, their prevention practices. So ensuring that we integrate, again, COVID-19 messages into other issues that people are most concerned about is becoming more important. Enabling behavior change as public health and social measures shift, and addressing those low risk perceptions, as I mentioned. Making sure that we're addressing some of the fears of accessing preventative health services. So making sure that people are accessing those health services and conducting some of those demand-driven campaigns. And really engaging youth as agents of change. They have a wide reach. They get, they're motivated, enthusiastic mobilizers. And so really tapping into those youth mobilizers has become more important. And especially as those youth can reach out to other youth, as we know more, learn more about asymptomatic carriers, to encourage preventive measures among other youth populations. So now I want to touch on just some major barriers that we've been facing in some difficult contexts. So as I've noted earlier, refugees, displaced persons, migrants, people living in urban slums and other low resource settings, are sometimes challenged in complying with COVID-19. So high population density, poor housing, limited access to water and sanitation, overstretched or inaccessible health services, and widespread poverty, these can all increase the risk and impact of COVID-19 in these types of settings. So I'll just highlight a few examples here of some of these challenges. So for example, related to livelihoods. So we know many people in humanitarian or low resource settings. So they're employed in the informal sector, such as trading goods or driving motorbike taxis, with really very little to no opportunity to work from home or be paid when not working. So with limited social safety nets in some areas, people may be forced to break then physical distancing or quarantine rules. So for example, according to one person in an urban settlement in DRC, how can we respect the lockdown against coronavirus when in our houses there's nothing to eat? Health systems. So availability of formal health providers in low and in many, availability of formal health providers is low in many settlements. There's multiple barriers to preventing the access to quality, healthcare from cost to, poor experience of the care and preference for traditional healers. So for example, in the Rohingya camps in Bangladesh, the IOM reported recently that there was a 50% reduction in visits to health facilities and a real uptake in traditional medicine. So with transient populations, there's been frequent movement. Frequent movement can make it challenging for contact tracing teams to regularly follow up on contacts of confirmed cases. And this can lead to the importation of COVID-19 to new areas. Contact tracing teams may also not be trusted by communities and viewed as spies. And so it's become more important for us then to make sure that the principles of risk communication and community engagement are being incorporated into contact tracing roles. So we as a subgroup have been doing that a lot more now. And so for risk communication and community engagement, in terms of our own implementation, there's also been major challenges. So for example, most camps host displaced persons from diverse countries of origins who speak multiple different languages. There may be limited access to internet or phone. There's congestion within camps and informal settlements, making organizing any face-to-face activities really challenging. And it's been really difficult to ensure that physical distancing can be maintained in those environments. So again, more creative and digital type of solutions need to be found. So those are just a few examples of some of those challenges. So now I'm going to go into some of the guidance for planning local solutions with some communities to look at addressing some of these issues. So first of all, it's important to really understand the community and the context. So this means, carrying out an assessment, including like community mapping, to understand what those community structures are, those power dynamics within the community, the beliefs and the capacities, the trusted and preferred channels of communication and sources of communication, for example. So some of these different types of information, it's really important to understand and collect. So then based on these findings from these assessments, really identifying which leaders and community groups and representatives you really need to meet with and start planning local solutions to managing COVID-19. So what kind of prevention measures can you discuss? There's all sorts of things like we discuss like physical distancing, religious gatherings, and really sort of working with the communities to find, these alternatives to some of the ways in which they've been gathering for religious ceremonies, for example. Maybe just touching on a couple. So for transport, for example, discussing with public transport operators, like how they can reduce the risk. So for example, by limiting passenger numbers to allow for more distance between people, keeping the windows open to allow for better ventilation or requiring passengers to wear face masks. So maybe just one example of a community-led solution that has been supported. So in DRC, the Red Cross volunteers supported communities to produce locally designed portable hand washing stations using household water jerry cans that the communities have already been using for collecting and storing drinking water. So they simply cut a small hole at the base of the jerry can and inserted a plastic tap, which is easy to find at a local market. So the hand washing stations, they're easy to construct and very low cost, and communities are now constructing their own stations and washing their hands more regularly. So then once these local solutions are agreed upon, they need to be communicated to the population with opportunities for people to ask questions and provide feedback on the potential challenges. So here, trusted community leaders and community health workers, influencers, role models, and groups should be supported to lead risk communication and community engagement then in their community. This might also mean training and enlisting the support of essential workers, such as pharmacists or market vendors, gas station attendants, frontline health workers, and so on. People who have that regular contact with people, as I mentioned earlier, and then can help share important COVID-19 information. Collecting testimonials from people who've recovered from COVID-19 to act as community champions and address the rumors and misinformation, such as COVID-19 not being real, are just some of the examples. So listening, analyzing, and acting on community feedback. This is really key. Rumors and misinformation that travels fast and can really quickly undermine the communication efforts. And so I'm going to touch a little bit more on this. So what do we mean by community feedback and why is it so critical? So first of all, the different types of community feedback that we're talking about here include rumors, observations and beliefs, questions. So these can tell us what people don't know, so there are gaps in knowledge and what they want to know. Suggestions for ideas for how we can improve and tackle issues and do better. And then what are people happy with? So this is also an important type of feedback. So this feedback really ensures that, that we're communicating about the right topics, and it helps us improve and do better. And it helps us to catch problems early and be able to respond to them. And it can also highlight cases of fraud and abuse. So to collect feedback, you need a feedback mechanism. And this can be done through listening exercises in the field with staff and volunteers who conduct risk communication and community engagement activities, or focus group discussions, key informant interviews. I've mentioned before we used WhatsApp groups, social media. So there's all different types of ways that we're collecting this type of feedback. And importantly, we're using it to address the rumors and misinformation and disinformation. And so, as we know, there's a lot of different rumors, misinformation, disinformation out there. And I'm not going to go through all of it because I'm sure all of you have your own, experiences of this as well. But what do we do with all of this, with this issue? So it's important to really listen to the community, understand what their beliefs and concerns are about the rumors they've heard. Really identifying, not only, what those rumors are, but really digging into, what they believe about the rumor and what information they really have. So it's also important for us to verify the information and to really engage the community so that we're not just so that we're responding to the rumor and not just ignoring or denying it. So we can replace that with sharing more factual information through trusted communication channels, using words in the language that the community best understands. So we can make sure that all of the staff, all of the volunteers, especially community mobilizers, are regularly informed about the latest rumors and how they should be able to respond to them if they hear them. And so finally, I just want to leave with, you know, regardless of what service area, what response area we're in, risk communication and community engagement really is essential and needs to cut across all of these areas and be an essential part of any sort of response and inform any kind of response, whether it's contact tracing or food security. And so I am available to take questions. I'm sorry I've probably gone a bit over. So thank you so much for listening. And I apologize if I went through some of these slides fairly quickly.
Thank you, Kathryn, so much for that talk. We have a few questions here coming in, but I also I have some of my own that I wanted to touch on as well. I mean, you went through quite a few strategies for risk communication and also for community engagement. Are there any in particular that you've seen to be working particularly well in certain settings, maybe some that aren't working as well in other settings? I'd be very curious to hear a little bit about your experience with how different strategic approaches have worked differently.
Sure. Yeah, so again, I'll go back to the two-way communication approach. So, you know, we have been constrained, particularly early on, in providing very one-way type of communication. So really kind of, you know, blasting messages out through, you know, through radio and some of the other channels, SMS, text, and some of these other ways. And that's important, and I don't want to discredit, you know, that process. But really sort of having that two-way conversation, getting the communities involved early on in the approach to really help kind of define, again, the communication approach that we're using. So involving them early on, and not just in the planning, but throughout the implementation of our response and of our communications.
How do you incorporate, this question is from Angelica Lopez, how do you incorporate harm reduction in the messaging to your communities?
How do I incorporate harm reduction? So can you, I don't know, can you flesh that out a little bit? Because there's many ways I can interpret that.
Sure, I'll ask Angelica to maybe to add some more detail to her question. Okay. Okay, so.
Well, sorry, maybe, I mean, if she's talking about how we incorporate safety measures into, you know, into how we're engaging communities, is that what she means?
I can't interpret it. You could interpret it that way and try to answer it. That's fine.
So maybe I'll just answer that then, because so as part of the guidelines that I provided, that I had illustrated earlier, we have captured some guidelines and some key guidelines on how to conduct engagement safely. So if it's in-person meetings, for example, keeping those meetings small, ensuring that we have hand washing stations available, trying as much as possible to ensure that the meetings are outside and not inside, or if inside in a, you know, highly ventilated area, that there's face masks available. So there's a whole series of different types of safety measures that we recommend are in place if we're conducting, you know, house-to-house visits or small, and I emphasize small, group meetings.
Earlier, you mentioned needing to adapt different approaches as policies change and reopening happens, right? That this is something that we've had to respond to. Can you think of any approaches that you've had to adapt or change based on in-country reception or acceptance of these approaches? Really trying to think about, I think, again, you know, what might be working well in some settings might not be working well in others, in areas where you've had to adapt or been able to adapt.
Yeah. Yeah, I'm going to have to maybe think about that one. And maybe let me be a little bit transparent here in terms of, the READY initiative. READY is not in the response. So we're providing capacity building. So some of these examples that I'm sharing with you, they come from our Johns Hopkins Center for Communication Programs, and some of the programs that CCP is implementing at field level. And then, through our subgroup and through some of the examples that have been shared with us. So maybe just to lay that out. So in terms of any experiences that the READY initiative might have, we don't really have those types of experiences. We're not, in the response. We're really more augmenting that capacity for the response. So let me think about that, and if I can address that, because we are, as part of our subgroup on community engagement, we are collecting these types of examples and emerging trends. And so that is a process that we're doing so that we could share those out more widely.
Okay. There is a question about how you involve and carry along people with disabilities to ensure success within communities. Could you talk a bit about that? And then I'll also ask for people, if you have questions, please make sure again to put them in Q&A, just so we can keep track of them over the chat. But yeah.
Yeah, thanks for that important question. So, through risk communication, community engagement mechanisms in country and at the regional level and at the global level, having the involvement of representatives from people with disabilities is really key, so that those risk communication, community engagement messages and materials can be tailored to those populations. And I know that that is actually being done in some of those mechanisms, not only at the national level, where they have those national level coordination mechanisms, but also, within sort of like the camp structures as well. So within those sort of camp management team meetings, having again the involvement of representatives from those more vulnerable populations. So that's the way that we've been focusing on that now.
Okay, so ensuring representation in those processes.
Everyone will agree that a lot more needs to be done there.
In communities where traditional medicine is relied upon and where medical professionals are not readily accessible, how do you recommend communicating best practice preventative measures while still showing understanding of current beliefs and accessibility issues?
Yeah, so, we've done this before, for example, in the Ebola context in West Africa, and, I'm seeing some of that here as well. Involving those traditional leaders to be able to, communicate preventative actions, to be able to, serve as a way in which we can, involving them early on in the response, so that they become part of the response, has been one way in which we've been doing that. And so, I'll provide just an example for, within Sierra Leone in the Ebola response, there was a big network of traditional healers. I think there was about 40,000 traditional healers in this network. And so the risk communication and community engagement coordination mechanism basically tapped into those traditional healers, into that network, and we were able to really reach out to them to provide them with the messages so that they can pass those messages on to their communities. And so, it's important to just involve them as much as possible. And there are networks of traditional healers that we can recruit into, that we can talk to and engage in the response.
So there's a question about, I guess, proven experiences or evidence-based approaches for tracking impact of risk communication activities. Are there any frameworks or approaches that you would recommend for tracking the impact of risk communications activities?
Yeah, so that is actually something that there's a separate initiative that I'm getting involved in with UNICEF, actually, to look at, through those principles, through those sort of 6 core principles of community engagement, looking at, different measurements and indicators of those principles of community engagement. But in terms of having this sort of real-time monitoring of our community engagement, risk communication activities, we can look to, for example, some existing data that's out there. So, for example, we can look at, service statistics, for example, to see how well we're doing with demand generation activities. We can look to, different organizations basically document their work and document some of the services and activities that they're providing. And so we can look at some of the documentation within those service industry. So there's a way that we can, look at existing information and existing data, existing documentation to see how well we're performing or not. And so that's one alternative, in addition to, whether we're going to do sort of these quarterly assessments in the field.
There's a question about stigma within the communities. Do you have any experience or recommendations for community engagement to reduce stigma, particularly among people who have been coronavirus positive?
Yeah, that's a real tricky one. So there are, it's tricky because, you want to be able to, engage, for example, people who have overcome COVID-19, who may have had it and now, are no longer have it, and to use some of those community members to be able to talk to other community members about COVID-19. There are ways that we have, brought different types of stigmatized groups together with other groups who are, are on the opposite ends of that and who are stigmatizing, and to kind of come together and have a dialogue. So really kind of showing how, and basically showing how, if we're looking at some of the healthcare workers, for example, who have also been stigmatized, there have been some hero campaigns, for example, that have been, like Vietnam had a really nice campaign around, health workers, healthcare workers, community health workers. And there was a really nice hero campaign around that showed these healthcare workers as heroes to help kind of reduce the stigma that they were experiencing at home and in their communities.
So that leads to another question that we have around, it's really around how do you engage with community members, not to harass health workers, right? So that's how this is put, but I think, we've seen this with other types of health campaigns as well, not just COVID, but really, I think just engaging with community members to accept health workers, or, perhaps as the participant says, not harass them.
I'm sorry, can you repeat the question?
Yeah, so how do you engage with communities to accept health workers or to not harass health workers?
Yeah, so again, I'll give the example of what they did in Vietnam by creating this hero campaign. And so they really engaged the news media, for example, to help sort of publicize how these community health workers, how these health workers were really heroes in their communities. You know, they were, there would be articles about them in the local newspapers and on TV, and you know, a local leader within the community, or a local politician, or someone within the hospital administration, for example, would present them with, you know, bouquet of flowers, for example, and there would be a ceremony really honoring those critical health workers. And that sort of helped to show them in a different light. And then just really kind of, you know, accelerating accurate information about COVID-19 and prevention, so that if we're taking these preventative measures of wearing face masks and social distancing, you know, it's an opportunity to really accelerate that information so people can feel a little bit more confident.
So Kathryn, perhaps specific to your experience in doing capacity building, there's a question from David Allen, and he says, engaging with and listening to the community requires sensitivity and an understanding that sometimes organizations from the global north don't have. How do you appropriately identify, employ, and provide leadership to country staff as opposed to US-based organizations to do this engagement?
Yeah, thanks so much. So one way that we're doing that is we are engaging people at the local level, at the country level, to facilitate some of these sessions with us. So it's not just us sitting, you know, in our offices, you know, talking about some of these issues, but really kind of working with people who are already, you know, working in the field, people who are, you know, working on their own solutions within their own context, to work with us in these training and capacity building efforts. So that's one way in which we've been doing that, and working really through. We've been working through the local Save the Children office, who's been kind of instrumental in kind of doing a lot of the outreach, and also participating in these sessions as well.
One question that I have for you, because I was really interested to hear you talk about engaging youth and have members of the youth community be risk communicators. So what are some strategies that you've seen for engaging youth as risk communicators?
Yeah, so there's been some really interesting ways in which UNICEF has been doing this in India, and so they've already had sort of these networks of youth mobilizers that they have engaged in different health promotion activities in the past. And so, you know, it was really just a matter of leveraging some of those youth groups. And they were really, you know, very active volunteers. They have, again, you know, different social networks, social media networks, and just regular social networks. And so it's been a very successful campaign that they've engaged in over there. And I'd be happy to, you know, after this call, provide more information, because I believe that they've documented that, and they may have a case study. So I'll share that after the call.
That would be great, because we'll post your slides and then any additional resources that you might have on the Center for Global Health website. So everyone should be able to access a recording of today's session in addition to those other materials. So thank you for offering to share those.
Great.
Okay, so I think we've reached the end of our questions for today. So I'll just reiterate again that all of these resources will be available for those who would like to revisit or learn more about some of what Kathryn discussed with us today. A friendly reminder for everyone, our last session within this version of this series will be next week, and we'll be talking about primary health care and COVID strategies, with an emphasis, a case study based on India. Again, Kathryn, thank you so much for joining us today and talking about this really important subject. I think this is something that we've really been trying to engage with and learn from for a while, and it's just it's been interesting to see all of these different cases about how you've gone and engaged with communities and started to do risk communication with them, particularly as the situation has changed and as places are starting to reopen. I think it's a great point that we have to be able to adapt and change over time. So if you have any last words, I'd love to give you a minute to just make any closing comments, and then we'll wrap the session for today.
No, just to say thank you so much for this opportunity. It's been a pleasure.
Great. And thank you all of the participants for introducing yourselves and for adding your questions today as well. So thanks again, Kathryn, and I hope we get to see you again soon.
Great. Thanks so much.